It has been proven that sleep apnea is an absolutely dangerous condition, in which there is a short-term cessation of breathing during sleep, from a few seconds to a minute or more. This can be repeated many times during the night, disrupting normal breathing and sleep. As a result, the patient gets chronic fatigue. Apnea prevents the body from fully restoring itself during sleep. As a result, a person experiences fatigue and drowsiness during the day, irritability and decreased concentration. Frequent episodes of apnea lead to fluctuations in the level of oxygen in the blood, which increases the risk of developing arterial hypertension, high blood pressure, coronary heart disease, stroke, heart rhythm disturbances, for example, the occurrence of atrial fibrillation, heart failure, metabolic disorders. Sleep apnea increases the risk of obesity and type 2 diabetes. Since improper functioning of the body during sleep impairs the ability to regulate blood sugar levels and control appetite. Increased risk of sudden death. Patients with severe forms of apnea are at increased risk of cardiac or respiratory arrest during sleep, especially in people with existing cardiovascular disease. Chronic oxygen deprivation and poor sleep quality can lead to memory loss, decreased concentration and cognitive abilities over time, which increases the risk of developing dementia. Irregular sleep and constant fatigue can lead to the development of depression, anxiety disorders, and generally a decrease in quality of life. Sleep endoscopy, or sleep endoscopy, is the only method for diagnosing the causes of snoring and obstructive apnea that lie in the ENT organs. It helps to accurately determine at what level of the upper airway the obstruction, blockage, occurs, causing snoring or respiratory arrest. The procedure is performed in a clinic on an outpatient basis, under conditions of drug-induced sleep to simulate the natural state of a sleeping patient. The patient is asked to come in the morning on an empty stomach. It is connected to monitors to monitor vital signs, pulse, blood pressure, respiration, and blood oxygen levels. To induce sleep, a medication is administered intravenously that causes superficial sleep, as close as possible to natural sleep. As soon as the patient falls asleep, the doctor inserts a thin flexible endoscope into the upper respiratory tract, through the nose or mouth. The endoscope is equipped with a camera, which allows the doctor to monitor the condition of the respiratory tract in real time. After the endoscopy is completed, the administration of the sleeping drug is stopped. The patient wakes up. Recovery from drug-induced sleep usually takes a few minutes, and there may be slight dizziness. The patient is monitored until his consciousness is fully restored and vital signs are normalized. Based on the information obtained during endoscopy and polysomnography, a decision is made on the treatment methods. These can be conservative methods, lifestyle changes, use of a CPAP device or a custom-made protrusion splint on the lower jaw, drug treatment or surgical intervention to eliminate the causes of the identified obstruction.